would like to greet all of you in the greeting words of peace and thank you for watching Knowledge for Life's Knowledge Cypher, where we bring together Black healthcare professionals to address serious issues that are impacting our community. COVID-19 brought out what was called pre-existing conditions in our community. As we know, with the mental health issue, we have a stigma. Today, we're going to be talking about our feet. And many of us don't realize that our feet give us an indication of our health. And today we have two specialists with us today, Dr. Tanisha Richmond, and we have with us Dr. Daryl Ballinger. And so what I want to do, just starting off, just to break the ice, is if you all can give our audience just a few foot idioms.
Idioms?
Yes, I'll start one off, for instance. I'll start a few off, and we've heard of this one. On the right foot, cold feet, drag your feet, foot in the door. Can you all think of any that comes to mind?
Unfortunately, it's too many people got their foot in their mouth.
Foot in their mouth. All right.
I don't know. I always just say take care of your feet. You only have two.
You only have two. That's right. But you know, there's that idiom, two left feet.
Yeah.
All right. That was just the breaking the ice. Get things. Because the subject is actually a really heavy subject. A lot of people, we don't relate the condition of our feet to our health.
Yeah.
So to start it off, can you give some examples of the health of your feet and how that relates to something that might be alarm?
Well, so when we were trained on the entire body. So I remember our first day of podiatry school, they told us we would be able to walk into a room and look at a person's feet and tell their health. Mm-hmm. And we can do that. And lots of times I can walk into the room and tell if a person smokes. I can tell if they're diabetic. I can tell if they're controlled or uncontrolled. We can tell their vascular status. We can tell if maybe they have heart disease, they're in heart failure, if they have other comorbidities by looking at their feet, because it all presents in their feet. So like when we walk in the room, for me, especially if they're like African American, I look at the color of their face, and I look at the color of their feet. So that can tell me their vascular status. If they're brown and then black on the bottom, they have a problem. Mm. If their skin is unhealthy, it's crusty, it's flaky, it just looks unhealthy, that tells me the health of the patient. Like I could tell if a diabetic is controlled or uncontrolled by their skin. Is their skin pretty? Does it look, like a foot model, or does it look like ugh? And and that's unfortunate, but we've had so much experience of just walking into rooms, looking at people, and then what we smell. Like we walk in a room and it smells like a chimney. We know they're a heavy smoker and they probably have vascular disease. So it's just, we look at the whole person, and that's what a lot of people fail to realize when they come to see us, why we want to know your entire medical history. Like I said on my podcast today, your feet are attached to your body. Mm-hmm. So everything that happens from your top to the bottom, it still affects your feet.
Thank you. Dr. Ballinger, what are some of the organs that are in the body that the feet will give a sign that there's issues going on?
So podiatrists, we're trained to look at everything from head to toe so we can get an appropriate assessment of the foot and ankle. And let's be very upfront and blunt. All the organ systems play some semblance of a role in terms of foot health. In particular, we have the dermatology, so your skin. You have your nervous system, which does many different things, from the musculoskeletal, so how your feet propel you, whether you have sensation, whether you have your autonomic, do you sweat enough? So all the nervous system, the dermatological system, the circulatory system, for your veins and arteries. You have your musculoskeletal system that can help propel you and do the things you need to do, or unfortunately cause you pain. So when it comes to the systems that you have, things that you wouldn't expect to have a significant amount of impact on your foot health would be like your GI system. For example, how many people have had a bariatric surgery and all of a sudden they're malnourished because they're not taking their nutrients, and all of a sudden they're now having skin issues because they're malnourished, and now their skin is manifesting that issue of malnourishment. These are all things that you have to take into account. And for example, even your mental health, if you have not been, for example, taking care of yourself mentally, that can lead to psychosocial problems, which can lead to wounds on your feet that are not appropriately managed. So once again, as a podiatrist, I look at all systems when I'm assessing my patient. Because if you're not looking at all systems, you're going to miss a glaring red spot, which could be significantly unfortunate in terms of either a patient losing their limb or their life.
So what are some warning signs that people should look out for? As you were saying, when we're growing up, our feet, they look shiny. Our nails look, shiny. But as we grow, then we start to see changes in our feet. And as we're saying, that's a sign that there may be something going on in the body. What are some of the signs that?
Well, I always, especially like my diabetic patients, I always tell them just to watch their feet, monitor your feet. Like if you wake up and your feet weren't like they looked yesterday, you have a problem. So you have swelling, redness, pus, drainage. Like I tell diabetics, we always tell them to wear white socks so they can see blood or drainage, because they may not feel pain, they may not feel a cut, but they'll see the blood. So it's being more on surveillance of your feet. And lots of times people just ignore their feet until they have a problem. And like Dr. Ballant just said, if they have a mental health problem, they may, they're on their mental health issues or what other issues that's in their life. So if you know you're a diabetic, you need to be paying more attention to your feet. You need to be putting a mirror like on the floor and so you can look at your feet, having someone else look at your feet. But just being aware of your feet. Look at them, clean them, wash them, look between your toes. But it's kind of like being a detective. You just have to be aware of what's going on. Like if you wake up and one leg is swollen and the other leg is not, or one leg is changing colors and the other leg is not, that's when you have an issue. That's when you need to talk to your primary care doctor. You need to see your podiatrist, go to urgent care, ER, something that happens acutely. But if you notice, like, you weren't swelling, but now you're swelling, like, we'll see that all the time. I'm like, well, how long have you been swelling? Is there any other problems? Are you having heart, kidney, liver disease? Why are you swelling? So we have, as physicians, we have to figure out why you're swelling, get you to a specialist who can completely determine where it's coming from. But as a person, as a human being, you have to pay attention to your body. Like everyone in here is aging. So we're all aging, but we know how we looked yesterday.
Right.
We knew how we looked last week. So if you wake up and one foot's black and one foot's brown or one foot's turning colors, you need to talk to someone, a medical person.
Yeah, for sure.
Yes, not your cousin that does hair.
Right.
You need to go see your primary care doctor. If you can't get to them, you need to go to your urgent care, ER. If you have a podiatrist, you need to reach out to them. But you need to let a medical professional evaluate your feet.
And Dr. Ballinger, can you, what are some good methods to taking care of our feet?
So, for example, I always tell patients a simple way of monitoring your feet is put on a little bit of lotion to your feet every day. It's one of the things that I tell folks, it's a simple thing, but it's an act to hopefully get you in a pattern what you go and do every day. So that way you can tell, oh, there is some redness, there's some swelling. I do have a cut on my foot. So that is a very simple thing. The other thing that I tell folks is making sure that we have at least a good exercise plan. I'm very simple with my exercise plan. So we're talking like 30 minutes a week of doing some vigorous exercise, whether it be fast-paced walking or jogging, or if it's cold outside, using exercise rubber bands. Watch a 30-minute program. You use your exercise rubber band. You can even do it sitting down. And then if you have access to a pool, getting pool water aerobics, because if you have joint pain and it's hard to be on your feet, then you know what? The pool will give you some buoyancy. And I tell people, look, between the exercise and at least getting one good healthy meal a day with more fruits and vegetables, and I always encourage people to eat your healthy meal for your first meal of the day, because let's face it, there can be bad choices made after that first meal.
Right.
So if we can get one good first meal of the day where we're having more fruits and vegetables, then I think that's a simple plan, because let's be very upfront. We get bombarded with folks trying to tell us you should be doing this to get your health to be right, or you should be doing this to get your health to be right. Nah, keep it very simple. A little bit of lotion on your feet once a day. Exercise, vigorous exercise for 30 minutes, 3 times a week, and at least one good healthy meal a day. And that is a good start point. You can always add from there.
Now, I know that some of us, we work construction or, some type of job like that, where sometimes our feet are in the mud or are immersed in water. What are some of the things that we should definitely look out for, and how to treat our feet to make sure that we don't get a fungus or anything like that by having dirty feet?
Clean them. Well, I mean, the biggest thing is changing your socks daily.
Okay.
A lot of people don't get that concept. You got to get a fresh pair of socks every day. And if you're in that kind of work environment, when you come home, we say take your inserts out of your shoes to let them dry out, or even rotate your shoes so you make sure they get dry. Because fungus likes warm, moist, dark places. So even if you're changing your socks and your shoes are staying wet, the fungus is having a good time inside those shoes. And then you can spray your shoes with Lysol. You can get antifungal powders to help dry your feet out. And then if you work somewhere where you may have a locker or access to, maybe at lunch, you could switch your socks out. But the biggest thing would be changing your socks daily. When you get home at night, take the insert out of the shoe, pull the tongue up, let the shoe breathe, let the shoe dry out really well. Or if you have enough, rotate them. So make sure you're not going to work with a wet shoe, because you're creating an environment for fungus and bacteria and yeast to have a party in your shoes.
So that fungus, is that fungus something that is coming in from the outside, or is it something, because I know we have fungus within us, is that something that's within us that maybe grows?
No, fungus is literally floating in the air we are around right now.
Okay.
So fungus has set up a happy home in the shoes. So this is one of the reasons why we say do the rotations, use the Lysol. But also, I always tell folks, if you're going to be in that kind of condition where you're wearing work boots, get work boots that fit. Because here's the deal. If you're having a work boot that's rubbing a sore into you, that work boot ain't for you. So I tell folks, you should get your feet measured. So for example, if you're going to any store that has appropriate work boots or any work shoe, you should have your foot appropriately measured. And I always tell my patients, look, you need to get 3 types of shoes. So 3 different brands at the right size. So that way, the brand that works best for you, you should buy at least a couple pair. Because here's the deal. Everybody asks me, well, what's the best brand shoe? I'm like, well, I can't tell you, because everybody's foot in here is different. And not everybody is going to respond the same to every manufacturer of shoes. So you've got to, A, get the right size, and then B, choose which shoe brand works best for you. And then I always recommend you buy 2, because sometimes they cut off that brand and you're like, man, I should have bought that.
Sure do. I know that. And so sometimes I've had shoes that I love so much, right? I worn them so much, but they become uneven when you walk, like cowboy boots. How detrimental is that to our feet and our ankles?
So one of the things is shoes do wear out. There are opportunities to go take your shoes to cobblers. Unfortunately, cobblers are few and far between, especially in the Dayton area, but we do have them. And it can be expensive to utilize a cobbler to even out your shoe. And this is one of the reasons why I do recommend getting a couple pairs of shoes if you can afford to do so. But once again, if you have a shoe that is wearing out, my recommendation is look, set aside a little bit of money to obtain a new pair of shoes, because what will happen is you may get some muscle imbalance, and then all of a sudden you're getting some muscle and ligament strain, and now you're getting pain in your feet. So I look at life like this. If you're not trying to hurt, you may be time to set aside some money so you can obtain a new shoe.
Okay. And for Black people, when it comes down to foot health, is there something special that Black people should understand when it comes down to foot health?
As a Black person and a Black physician and a Black diabetic, you have to be your own advocate. And unfortunately, in African Americans, a lot of us don't understand what's going on. A lot of us walk into that room with fear because of the Tuskegee experiments and all the things that have happened to us, or we've heard that's happened to our ancestors. And it's a lot of racial disparities. So it is a racial aspect of it. But it's a lot of it in African Americans is just fear. Because my uncle has one leg. So we all know someone that's lost a leg. We all have a family member that's lost a leg. So the first thing that as an African American we think, oh, I got this sword, they're gonna cut my leg off. And lots of times what happens is they come in when it's too late. So they have gangrene, or they may be like, I'm from Louisiana, so Mississippi, Louisiana, #1 states in the country for amputations, but they don't have access to as much vascular surgeons as they have like up here. Like me and Dr. Ballinger, we have access to a vascular surgeon. We have them in our cell phones. If we see something bad, I'm texting, I'm calling my vascular surgeon, where you at? Because because I got you one. I need you, I want you to see him today. And depending on how they're trained to be conservative. They're trained to save this limb because they understand if they die, if they cut one leg off, they got a 50% chance of being dead in 5 years. If they cut 2 legs off, they got 100% chance of being dead in a year. So, but it's education, it's location, and then it's access. So it's multifactorial, but there is a racial aspect of it. And it's still racism that it does exist. Still in America, still in healthcare. But a lot of it is the fear that we have been indoctrinated, but we see it. So we feel it. And lots of times patients will come to me, you gonna cut my foot off? I'm like, we in my treatment room. What? Right. Cut what off? What? But it's just in their brain. If I step foot in this ER or OR, this doctor's office, they're gonna cut my leg off. So they sit at home and they watch it and they soak it in Epsom salt and they call their cousins and they take old antibiotics and put home remedies on it. Then they show up to us with a gangrenous foot. Right. And then there's nothing else we can do. So it's multifactorial, but I think a lot of it's environmental, a lot of it's historical, a lot of it's education, and a lot of it's access. Like I said, in the South, they don't have the volume of doctors who can just come in and save a leg. They may have more orthopedic surgeons than vascular, than podiatry. So it's multifactorial. Okay.
And that being said, unfortunately, my group does the most amputations in Montgomery County. Of the 400 plus surgeries that I did over last year, 200 of them were amputations. I do at least 2 to 3 amputations a week. And when it comes right down to it, I use amputations in a light that people don't quite understand. If you're losing a toe or a portion of a foot, it's literally so I can save your leg. Because a below the knee amputation, in other words, a major amputation, has a 50% mortality rate. In other words, within 5 years, 50% of my patients will have died if they have had that below the knee amputation. One of the other problems, and I understand that people will look at it as racism within the healthcare world, but it's also in the business world and the political world. I mean, you got to look at it like this. We have had a hospital system close down a hospital that was on the west side. Now we have been left with one hospital that is a full functioning hospital with an ER and surgical suites. But then we also don't have OB over on that location. So when it comes right down to it, we are looking at it as there's individualized folks that are worried about the racism that they may experience, because also we're not getting a lot of doctors coming out of the west side of Dayton. Ideally, I would love to change that, and I've been making significant steps towards that. But then you have to also realize there are other entities that have made decisions that have negatively impacted heavily populous minority areas in the Dayton community. So when it comes right down to it, while individuals may feel not wanted by the healthcare system, the healthcare system, along with policies of businesses and city governments, have made it significantly easier for those individuals to say, yeah, we aren't looking out for the best of you. But it is really up to the physicians that are still working on the west side to say, no, we don't want this. We want better for our patients. I've been on the west side now for over 8 years. Dr. Richmond, how long you been?
16.
See?
Wow.
So when it comes right down to it, it is staying in an area that will provide the best care to patients so we can minimize the amount of surgical amputations. And especially, I think we have to break it down between smaller surgical amputations of maybe losing a toe or a portion of a foot versus doing a below the knee amputation. Because once you go to a below the knee amputation, the risk for heart attacks and strokes elevates significantly. Your body can't take that shock. You're losing a lot of blood. Your body then has to adapt to that loss of blood. Sometimes we don't do a good job doing it. That's where, and then you got to remember, if you've already had issues where you have been ill for a significant period of time, your body don't bounce back after a major surgery.
And, one of the things that some people wear are those socks to keep the blood pressure. Compression socks, right? Because as you're saying, once you get below the mid area, there's nothing to pump that blood like we have the heart.
The muscles of the calf. When you walk, it pumps the blood.
The calf
So when
muscles.
you lose the calf, the heart has to do the work. So that's why they die of heart failure, because the heart no longer has the legs, and then they're not active. Lots of times, like he says, when they get amputations, they don't get a prosthetic leg. They never walk again, so they're not active anymore.
Right.
Because like the only people you see running around usually is like veterans, because they're already in peak health. So they bounce back. And then, of course, they probably have the best prosthetics on the market.
Okay, that's true too.
Because they're veterans, and then probably the best care, because their work, it's a specialty field. There's so many amputees from veterans.
Right.
But like lots, like you said, they're sick already. They have all these other, by the time you're in the point of getting an amputation, you have so many other comorbidities.
Right.
You're not going to bounce back. And then, you have the depression, you've lost a limb. You're grieving.
The cost of losing a limb, it's expensive to have these amputations. It's expensive to have these wounds. We're talking about for a prosthetic, you may get one prosthetic that costs approximately $5,000 for the lower leg, but you know what? You may go through 5 prosthetics in your life. That's $25,000. Getting a motorized wheelchair can cost up to $10,000 to $15,000. We're talking about like used car prices. Well, nah, it's like $20,000 for some used cars. Let's be real. I'm just saying,
Right.
this is expensive.
Yeah.
Healthcare overall is expensive, but especially when you're having your feet cost you. So our goal has been and always will be, if we can keep your feet, we can keep you going.
Right. So that's once again, that is very enlightening, and that's something that maybe we haven't even thought of, because we see, as you just stated before, we'll see a family member without a foot, but we may not see that prosthetic. And one of the reasons why we may not see the prosthetic is because of how much it costs.
Well, no, they don't wear them. I have a patient. He's been coming to me since I've been open. He's never walked in. He's always come with his prosthetic limb. I have patients who never wear their prosthetic limbs. Then I have some that do, and they're still around.
Right.
Versus the ones that never did, because they're not active.
And part of the other problem is that they may have their prosthetic limb. Is the fit right? Are they having the appropriate shrinker on their prosthetic limb? I, at my wound care center, do evaluations for the prosthetics for the below-knee amputation. Sometimes prosthetic limb is too loose and it doesn't work anymore. But if you can't afford it because it's another $5,000, then you know what? You don't use your limb. So once again, the socioeconomic issues of losing your extremity can be devastating. And I keep on telling folks, look, this is why we check our feet every day. This is why if you get into trouble, get in soon. Because unfortunately, the way I practice, if you are seeing me in the hospital, your limb might get missing because I am the last stop on the long road to the short leg. So if you seeing me, that is not a good thing.
Right.
And I consider myself a fairly good surgeon. I consider myself an ethical and responsible doctor. But I can't save everything if it's gangrene. It's got to go.
Right.
It's dead.
And so one of the organs that as I did my research, that the foot is tightly connected to is the liver. Can you talk about?
So some of the problems that I see, especially in the area, and this goes back to the mental health issues, alcoholic cirrhosis with neuropathy. I mean, I just saw a patient earlier today with neuropathy due to alcoholism. Your liver is one of your main processors of drugs. It's one of your main processors of food that comes in that then provides nutrients for you. I mean, I deal with plenty of patients in the hospital system with ascites. If they have ascites, they're also having difficulties breathing because their ascites is fluid buildup in the abdomen because your liver ain't functioning, right? So we're talking about multiple taps in your liver. And then also if you have, for example, liver damage from either poisons, like alcohol can be a poison. We're talking about hepatocancer. And now you're talking about trying to be on a transplant list. Trust me on this one. I have plenty of wound care patients who are on transplant lists, from kidneys to livers to hearts. I tell patients, look, liver, it plays a role, but it's the entire health. I'm looking at people from top to bottom, from their congestive heart failure to their end-stage renal disease, to their bariatric conditions, to their neurological conditions. So once again, a liver is a part, and it's a part that I see on a consistent basis. But once again, it is the whole person that you have to worry about.
Absolutely. Would you like to?
I agree. I mean, he He sees them more end stage than me. I see him more chronic in my office. As far as liver, I don't see as much neuropathy that's coming from liver disease. I would say most of the neuropathy and nerve damage I see is coming more from diabetes. I might see an alcoholic that has alcoholic-induced neuropathy every few months, maybe. So in my patient population I'm dealing with more kidney failure, uncontrolled diabetes that's causing the problems, less than liver disease. It's more kidney disease. Like we have more dialysis centers now than we have dollar stores. Actually, when the dollar store closes, they put a dialysis center.
Right.
And you notice what side of town they're all on. So that's where I'm seeing more of renal failure, all the complications from uncontrolled diabetes. And like we see, most comorbidities are not alone. So if they got heart disease, then they got kidney failure, then they're a diabetic, they done had a stroke, they done had a heart attack. Then if they had a heart attack, then they had vascular disease. So it's never one thing.
Right.
It's a multitude of problems that we're dealing with.
How does neuropathy manifest in the feet?
Usually it's numbness, tingling, burning. They tell you their feet are on fire. They may tell you it feels like something's crawling on me, nothing's there. Something feels like there's something in my shoe, and I pull my sock out, nothing's there. It can be random things. Like you just feel like you get shocked. A lot of times they describe it as electricity. Feels like electricity.
Okay.
So for neuropathy in the patient population that I see, it's not just the nerve tingling, burning sensation. It's the pseudomotor. The patient's not sweating as much, so their skin is dry. And then they might be getting hospitalized more often with cellulitis to the foot and leg because their skin is so dry that they crack, bleed, get bacteria into those cracks. Now they have an infection that's creeping up their leg. So now they're hospitalized, and my team is on board managing the wound care. Okay. The other thing about neuropathy is that, think about it like this. When you're a kid and you step wrong and you jump back like, man, that hurt. Like that sensation of pain lets you know, hey, there's a problem. Don't step like that. But when you have neuropathy that is so profound and you step wrong and you don't get that signal in your brain, that was a bad step. All of a sudden, maybe a little chunk of bone moves just a little bit. And then it just moves again. And it moves again. And all of a sudden, you used to have an arch, and now your foot's pancake flat. And now you have a pancake flat foot, and now there's a wound underneath because you didn't realize that every step you were taking, everything was breaking.
Yeah.
That is Charcot neuropathy. And that is one of the reasons why multiple patients end up at my wound care center, because they end up with a foot that is so deformed. Because if you take a look at their x-rays, most of their bones in the middle of their foot are all broken and sagged down. And then my team is called in to try and fix that issue. Sometimes we can, sometimes we can't.
So flat feet, that's not a natural?
Flat feet can be natural.
It can be.
But this is unnatural. This was brought on because you can't feel the fact that your arch of your foot is collapsing because you can't feel pain. Because like I said, that time when you were a kid, you can step and then be like, ooh, that hurt. Let me not step that way. That's gone.
Yeah.
So when it gets right down to it, neuropathy is a blessing and a curse. Because I'm going to be honest with you, you wouldn't want that many broken bones in your feet, because if you could feel all of that, that would hurt pretty dang bad. But when you have such profound neuropathy and you don't feel there is a problem, well, then there can be a very big problem. And unfortunately, that can be a limb loser.
So when people sometime experiencing cold feet, is that a sign of?
Well, that could be a sign of vascular disease.
Okay. Because that's not normal, is it?
So
I mean,
Sometimes it can be, but
yeah.
you have to also look at the risk factors.
Okay.
So, like I do ABIs in my office. I'm sure he does ABIs or sends patients out for ABI. So, as podiatrists, we're looking at risk factors. So, every diabetic that comes through my office, I do an ABI. Every smoker, I do an ABI. Anyone looks suspicious, I do an ABI. Anyone with wounds, I do an ABI. So, this is a very basic test that can determine a person's vascular system non-invasively. So we go off more of risk factors. Like if you say your feet are cold and you're a 20-year-old that doesn't smoke, it could be something else. But if you say your feet are cold and you're a 60-year-old diabetic that smokes 4 packs a day, we're worried you got vascular disease. So it has to go with the environment. It has to go with other comorbidities, have to go with their lifestyle as well. So it's different reasons, but usually we're going to dissect it down and we're going to get tests to prove our theory. But generally, if it's a child saying their feet are cold, it could be something else versus an 80-year-old.
Okay.
So the ankle brachial indice, the ABI, is really a simple test where we put pressure cuffs on your arms and your legs and sometimes on your toes, and we try to measure the differences between the arms and the legs and sometimes the toes. And if you have a bad ankle brachial indice, this is one of the reasons why we are lucky to be in Dayton with the appropriate vascular surgeons who will then perform a computerized angiography, a CTA. So those are more invasive. Those tests, we inject a dye and we then can see what your arteries look like from your heart down to your toes. And we can see if there are any blockages within the branches from your abdomen to your groin, to your thigh, to below the knee. And if there are blockages, we can decide, okay, what type of treatment can we give to you so we can open up those arteries? Because if your feet are cold and you got blocked arteries, your feet are at risk for wounds. And I keep on telling folks, look, if you've got bad blood flow from your heart to your toes, you're at high risk for getting an open wound. And like I said, you don't want to see me, all right? And if you're in the hospital, you ain't trying to see me.
Right.
And so my goal has been and always will be an ounce of prevention is worth a pound of cure.
For sure.
Because if we can get your blood flow better before you have to see me in the hospital, that's where we're going to be.
So can the presence of swelling or inflammation in the feet signal certain diseases or disorders?
Yes. I mean, so when a person comes in my office and they're swelling, I'm always going to ask a couple questions. What's wrong with your heart, kidney, or liver? Which one doesn't work? And they'll say, oh, I'm in heart failure. Well, that explains your swelling. Because the heart, so we have two systems in our, well, we have three. You have a vascular system, you have a venous system, and then you have a lymphedema system that runs between. It's like the dump truck. It takes the stuff back into the system. So the heart has to pump all that blood around the body. So if the heart is weak or tired, it can't pump it around. So it pools in the legs. So the same thing, so the kidneys and the liver, they clean the blood. So if they're not working, the blood pools. So, and then sometimes it can be what's called venous insufficiency. And that's where you'll see the people walking through the mall, and if they're Caucasian, their legs will be white, then you hit their ankles, they're brown, they're pink, or you see a black person, their legs are brown, you hit their ankles, they're jet black, their legs are swollen. So that could be a venous problem. So that's their veins, what we call incompetent. So the valves, we have valves in our veins, and they make the veins want to go up, but they don't want to come backwards. So the person with that kind of problem, their valves don't work, and they let it backflow. So they get the swelling, they get the discoloration, they get the skin changes. So So it just depends on the history. I wouldn't just say it's inflammation, because when you mention inflammation, then we're thinking more infection.
Right.
So because you may just have inflammation in one spot, like Dr. Ballinger talked about cellulitis from cracks in the skin, that could be inflammation. But when you're seeing systemic swelling, then you're looking at the comorbidities. You're trying to figure out which system is not working in their body.
Okay.
So, and then there's unilateral, in other words, one of your legs swollen, and now you got to worry about, okay, do you have some blood flow issues like a deep vein thrombosis? Because if you have a deep vein thrombosis and you have a blockage of your vein, and that blockage can break off and then get into your pulmonary system, now you got a pulmonary embolism. So one leg that's swollen, unilateral leg swelling.
The pulmonary embolism means what exactly?
Pulmonary embolism means that your lungs have alveoli, which helps to transfer oxygen from the air that you breathe in to your blood. Now, pulmonary embolism means that there are little particles that block that, and that can come from the leg and move into the lungs and then cause blockages in your lungs, which then means you can't breathe well enough, which means that if you ain't getting oxygen, you might be dying.
Right.
Yes, quickly.
Yes. And it's one of the things that we tell people, look, pulmonary embolism, deep vein thrombosis requires a significant amount of medication to help manage. We're talking about medications such as blood thinners, such as aspirin, Plavix, Eliquis, and these medications, while very helpful, are not benign.
Right.
Because we have to make sure there's a balance with these medications. Because if you have one leg that keeps on swelling and you keep on getting blood clots, we may have to put you on these medications. You may even need to have surgery to put a filter into your vena cava, which is part of the venous system that's in your abdomen. So I tell folks every day, if you have that one leg that keep on swelling and you ain't coming in, we might not see you the next day.
Right, right.
So those are problems that need direct medical care. That ain't calling your friend on over and be like, hey, what do you think? Nah, go on ahead, go to your doctor.
Right.
The ER.
Exactly. Because we ain't trying to have you out here having shortness of breath because now you got a pulmonary embolism.
Right, right. So how does gout, I mean, a lot of us in our community, we hear that word gout. How does that play into foot health?
So gout is a problem with breaking down protein. So protein, when we break down protein, we have a byproduct called uric acid. And uric acid comes out in little crystals. And the body, when it sees these crystals, the white blood cells eat them. Well, these crystals like to hang out in our big toe joints, our distal joints, our elbows, sometimes our knees. But their favorite place to hang out is our big toe joints. So that's why everyone says it's in their big toe. And then when that happens, instead of, you're not having an infection, but your body is reacting like an infection. So it's a red, hot, swollen joint. It's pain like no other that I hear about. And most people, when they have a gout attack, when you ask them, what did you eat last night? Oh, well, you know, I had a fish sandwich, I had pork chop, had 2 beers. And when do you have gout attack? Oh, when I have a fish sandwich, and 2 beers. So most people know when they're going to have a gout attack. But a lot of people think, oh, I'm going to drink this cherry juice, I'm going to do these home remedies instead of coming to see us. But we check your uric acid levels, we put you on gout medication, we educate you on a gout diet. So when you decide to do this again, you'll have your gout medication on board. And then there's other medications, there's newer medications, there's IV medications that can help, like with the gouty tophi. Sometimes you'll see that on people, they have these huge lumps under their skin, usually on their elbows, sometimes hands, wrists, and that can help dissolve the uric acid. So it's a problem with the way their bodies break down protein.
Okay. And so the gout, can that be like mistaken sometimes with maybe they thinking that they have arthritis?
It is a form of arthritis.
It is a form of arthritis. Okay.
Over time, it can cause arthritis. Gout joints look like a rat's been biting on them. We call them rat bites.
Okay.
And we'll see, because I had a patient and I hadn't seen that probably since radiology, and I was like, "Ooh, rat bites!" Gout so long that the little crystals had been dissolving the bones in his joints.
Okay. So, are there specific changes in foot shape that can indicate hormonal imbalances or deficiencies?
So, for example, when women become pregnant and they end up having significantly more swelling in their foot and ankle, it's part of it is because women are having elastin being produced as a hormone, because if you got to push out your baby, the elastin is a hormone that helps you do that. But it also doesn't just make your vaginal area push out the baby. Everything gets elastic, including your veins in your legs. So also the ligaments in your feet. So women experience, for example, swelling in their lower extremities, and that swelling can be painful because what happens when you put too much water in a water balloon? So that tight swelling, that hurts. And then also the flatness of the feet. Part of it is that elastin, especially in the third trimester, you've already gained hopefully an appropriate amount of weight, but now you got this extra weight on you. You got the elastin working, your feet getting flat, and everything's hurting. So hormonally, we typically see that in women who are childbearing age and especially in pregnancy. But the other thing is, once you hit menopause, that osteoporosis is coming for you. Because if you're a woman and you've hit menopause, you do not produce your estrogen in a manner that's going to help you maintain and keep bone health. This is why from the top of the program, we talked about exercise. We talked about diet. You know what? Once you hit menopause, that don't go away. You still have to have the appropriate exercise. You still have to have getting at least one good meal in for your diet, because osteoporosis, it's not just foot health, but, you know, broken hips, broken ankles, stress fractures in the middle of your foot. If you have osteoporosis due to lack of estrogen because you have hit menopause, that is a real thing that we have to manage.
Okay. So as we begin to wrap this up, and we'll have to come back and do a part 2, because there's so much with foot health, and we got just a few questions out. So maintenance of the feet. Let's look at what we should do when we go to look to purchase a shoe. How should we take that approach? Because I know me, I'll just go out there and just look for a shoe. But like you said, we should look for a brand that actually fits our feet. But how do we go and do that?
Well, like Dr. Ballard just said, especially in diabetics, you should be measuring your feet. And they always tell you to get shoes at the end of the day.
Okay.
Because if you have swelling, you'll have the swelling at that time. And then you need to be realistic with your feet. I talked about that on my radio show. If you a double, triple wide E, do not put your foot in a narrow shoe. If you're just walking around shoe carnival and your feet hurt, that is not your shoe. You need to be realistic with your feet. And especially if you are diabetic, you should be wearing diabetic shoes. You should be wearing shoes that accommodate your foot style. Like if you're a chronic sweller, you should be wearing more Velcro shoes so you can tighten and loosen as you need, or use, have the shoes with the strings that can loosen and tighten and accommodate your swelling. Like he spoke of, if you work in the industry, have multiple pairs of shoes. But another thing is just being realistic. Like he talked about pain. That is our gift from God. Pain is there to tell us, stop. If you can't walk from the front to the back of Shoe Carnival in them shoes without your feet hurting, those are not your shoes.
Right.
You can't, as we age, we cannot, we're looking for comfort now, not style. You know, I used to be able to rock a 3-inch heel. All those have gone to Goodwill because I can't wear them anymore, and I'm not going to try.
Right.
So, but I mean, as you age, as you change weight, as you change industries, you have to find the shoe that accommodates you without pain.
Yeah.
And like now, I dispense diabetic shoes in my office. I say they're quite nice. They're quite stylish.
Okay.
They come in all different styles. They're cute now. And no one will know they're diabetic unless another diabetic has them.
Mm-hmm. Well, what's the difference in a regular shoe and a diabetic
So diabetic shoes were created through the Social Security Administrations. So they are designed to protect the diabetic foot. So they're wider, they're deeper, they have no seams on the inside of them, so they don't rub. And then they have plastizone inserts that go into the diabetic shoe that decreases shear force, which causes calluses. And then they heat mold to the foot. And like if Dr. Ballinger has to do an amputation, then I can make them custom inserts that fill in the amputation so the feet don't slide and slip and things of that nature. So they're designed, they're like cocoons for the foot. Yet stylish now.
Okay. and Dr. Ballinger, she talked about women in heels. How does that impact the foot?
So sometimes people don't realize the heel puts a lot of force on what we call the metatarsal head. So if you go from where your toes are and you go back to where they bend, it's those metatarsal heads. People can get calluses, people can get stress fracture, and I tell folks you can get nerve issues because you're pushing down hard on the front of your foot. And that can cause pain, that can cause irritation, but also you shorten your ankle at the back of your calf. And over time, that shortening of that ankle can cause continued forefoot pain. But the bigger thing about heels is if you want to look cute for here and there, go on ahead and wear them. But it shouldn't be an everyday shoe. I don't stop people from wanting to live their best life. I just don't need them living their best life at all times.
Right.
So if you got a little event, go on ahead. Go ahead and do the 3 inches.
But put your house shoe in the car. The shoe
Go ahead.
in the car for afterwards.
So now we're looking at some preventative care to maintain optimal foot health and potentially ward off systemic illness. You mentioned Epsom salt.
No.
Is that? Well, I mean, you talked about Epsom salt, about how our people will soak their feet. Not that you know,
No, we're not big on soaking.
Okay.
Because soaking dries out the skin.
That's what Epsom salt will do.
Yeah, it dries out the skin.
Okay.
Now, like in my office, if we're doing nails and calluses and they're severe, we'll do a soak, but that's to soften up the skin to the point I can trim that callus or trim those nails without hurting me and the patient. But we don't, and we're not big on soaking because it does the reverse.
So think about it like this. Water everywhere and not a drop to drink. That's why we don't drink seawater. Because seawater, when we drink that, it takes all the water out of our body. And that gives you kind of like the salty diarrhea. And your body don't want that. That's what you're doing when you're doing Epsom salt soaks for 2 days long. You're taking out all the hydration out your body. Now, we do use that as a Dombro soak solution for some infections. And I use that for leg swelling and infections. I'll do a Dombro soak solution so I can decrease the swelling in the legs and make the pH around the leg, around the swelling, so not hospitable to bacteria where they hopefully will die, but this ain't like an everyday thing. This is when we're using it when we absolutely have to.
Okay.
Yeah, so people like to soak too much.
I like to soak too much.
Yeah, we like lotion.
Okay.
Yeah, hydrating the skin is fine.
You just don't put it between your toes.
Okay.
Unless we tell you to.
So when people have, for instance, smelly feet, that's not from, what are some of the causes of that?
Usually athlete's foot.
Okay.
But odors are very powerful.
Mm-hmm.
Like we can walk into a room and tell you what's wrong.
Yeah.
We've smelled enough things.
Oh, I can imagine.
we walk in the room, we're like, and especially if we see certain colors like green.
Pseudomonas.
We know Pseudomonas, which is a form of bacteria. It loves to live between the toes. And then it also loves venous stasis ulcers too. It has a horrific odor. It can clear a room. And then gangrene has its own odor. Athlete's foot has its own odor. Wounds that are infected yet not deadly have their own odor.
But deadly infections may not smell. And that's one of the problems in the Dayton area that we've been experiencing with my team with streptococcal infections. It doesn't smell, but you have this redness that is up and down the leg. And then now that's a surgical emergency because this is necrotizing fasciitis. And then it becomes a very smelly wound within a 12-hour period. Not a 24-hour period, 12-hour. And this infection, if not managed within 72 hours, you are dead.
Dang.
So these are the types of patients that come into my office. And yes, it's sometimes we are going straight to the OR from this room today.
Yeah.
And it may not smell, but I can tell you if your skin is flaking off red and it's creeping up the leg and you are having blood pressure issues, you're sweating too dang much, you're diaphoretic, no, we're going to the OR that day.
Okay. So just a few more questions. I think one of the common things that people see is the foot fungus. Is that something that is just an issue with the foot and toe, or is that something that can affect?
Fungus can live anywhere on your body. So when we talk about athlete's foot, that's on your foot. You can have tinea capitis on your head. You can have jock itch in your groin. You can have yeast infections in the vagina. So it lives all over the body. In our case, it likes the feet and the toenails. So that's where we hone in.
Okay.
And then it can live between the toes and really have a good time. Because that's when we're talking about like the Pseudomonas, the bacteria. You got bacteria, you got yeast, you got fungus living in there. So they're in there having a good time in there between your toes. So lots of times that's why, especially when I see colors and odors I don't particularly know, we're pulling out swabs because we like to culture. We like to see what's living there. We like to see what will kill what's living there. So it all just depends. And then the health of the patient. That's important. So if they're an uncontrolled diabetic, if they're in renal failure, they're a drug addict, they're a smoker, then we're getting even more aggressive because we have to help them fight these infections. Okay. So it just depends on the whole person.
Right.
Like Dr. Ballinger mentioned before, it's not just the foot. They're attached to the rest of the person.
Absolutely. So
when we see certain things, we're looking at it from head to toe.
Yeah. Because
we're like, okay, like I'll have an emergency. I'll call him. I got you one. I'll call my vascular friend. And I'm like, where you at? Where you at? I got one for you.
Right.
Because I know they do not need to go home. They need to go straight to the hospital.
Wow.
To the ER, to the OR. Because I know well enough to know, okay, if this goes home, next they're going to be visiting house a week.
Okay.
Because this is a life or death situation.
Right. Okay. All right. So closing out, let the audience know how they can contact you, and if you have any events or anything coming up, how they can check those out.
You can reach me at 937-228-3668. You can call or text that number. You can also visit my website, richfeet.org. You can submit your information to get an appointment scheduled. And then you can also listen to me as well on my podcast.
Okay.
I have a podcast on Spotify, Rich Feet Podcast as well. And then as far as foot health, I say just pay attention to them.
Okay.
Look at them. Clean them. Look between your toes. Look at the bottom of your feet. If you are a diabetic, get you a mirror. Look at them. Ask your family member, you see anything new down there? Wear your white socks. And they always say, well, what does it do? It just lets you see the blood or the drainage on your feet. So if you, like we said, if you don't feel pain, you'll walk on something, you'll step on something, you'll walk on a toy, but you don't know that toy is there until you see the blood. So, and then when you're in a high-risk situation, you're a diabetic, you're in renal failure, you're in heart failure, you're having all kind of other health problems, your feet are now high risk. The things you did as a child, you can no longer do. You can't walk to the bus stop. You can't walk to get your mail with your shoes off. No, you got to protect your feet.
Okay.
And then once you become a diabetic, you have walked through a new door you cannot walk back out of. Your feet are now diabetic feet. They are now high risk feet. You can't pick at them. You can't take stuff out of your kitchen, your garage, cut your calluses, cut your nails, have your cousin cut your calluses or cut your nails, use sharp instruments, cheese graters, none of that on your feet. Like I tell my diabetics, there's one guy, his feet were scary. I told him and his wife, all you can do is put some lotion on them. That's it. It's wash them. You can't do, because he like to pick the skin off and I was like, no, lotion, that's it.
Yeah.
Nothing else, nothing sharp. Because, you know, his skin was so delicate. He was a Caucasian male, but his feet were purple. So, yeah. So, you know, the biggest thing is just being under surveillance. Your biggest thing is if you are a high-risk individual, you should be seeing a podiatrist. The day you get diagnosed with diabetes, within a month, you should have a podiatry appointment. Because I call us, we're your foot angels.
Right.
We're here to take care of you. We're here to save your feet so we can save your life.
Thank you. That's good.
So, just to let you know, my practice is a little bit different than most general podiatrists in the area. Certainly, I work through Kettering Health Network, so you can look me up through the Kettering Health Network. But once again, I'm usually getting calls from the ERs. I'm getting calls from other physicians that have significantly high-risk patients. My team, we're in the operating room daily, Sunday through Sunday. So when it comes right down to it, you can certainly get a hold of my team if you feel like you have a friend or family member that is significantly high risk. Because unfortunately, the role that I play in the community here is I am the high-risk save your limb surgeon. And when you do see me, it does mean that my goal is to save your limb and save your life. So, like I said, our goal is to get you to be walking with two limbs. And if you want to get in contact with my team, through the Kettering Health Network, you can certainly look up Daryl Ballinger and we can get you sorted. But once again, once we have done the appropriate things to help manage patients, we typically send out to the community foot and ankle specialists, such as Dr. Tanisha Richmond, because we do still need long-term monitoring care. And the best thing that I keep on telling folks when it comes to just making sure their feet are healthy is just make sure your whole entire person is healthy. I keep on reiterating the same thing. You can put on a little bit of lotion, check your feet once a day. That's simple. But you really should at least be trying to get one good healthy meal a day and let that be your first meal of the day. More fruits and vegetables. And I'm very, very simple. 3 times a week, exercising vigorously for 30 minutes, whether it be walking fast, jogging, using exercise rubber bands, doing something on a consistent basis to keep you healthy. I'm a simple man with simple plans. That's all I ask of you.
Yeah.
And then after they do their vigorous exercise, take your shoes and socks off and check your feet for blisters.
Yes.
Or red spots, or rubbing,
Absolutely.
stuff like that. They gotta, like I said, you have to be on high alert because your feet are now high risk. And usually that's how they get in trouble, because they're in denial of their diabetic feet.
And like I said, if you are in trouble, your goal is really not to see me. I tell people every day, my goal is to get you healed enough where you don't ever have to see me again.
And Dr. Ballinger, you closing out with yourself, at the very beginning, you were talking about inspiring and motivating and encouraging young people to go more into that profession. Can you say something to young people as we close out?
In the next 15 to 20 years, we're going to have most of the baby boomers retire from practicing medicine. We don't currently have enough individuals as a whole to replace those doctors that are retiring. Not only that, our population still is growing. They're growing older. And unfortunately, for segments of our population, they are growing sicker. We have had dips in life expectancy, especially through the times of COVID. So not only are we having individuals needing more care, there aren't the doctors to replace them. I tell people every day, look, if you feel there is a calling for medicine in you, and in particular medicine that can really help save lives, being a podiatrist is a great calling. I have patients' families. I talk to every one of the kids that come through my office and say, if you want to rotate through my wound care center, I have no problem getting you to my wound care center, and then we are going to go through, this is how you become a doctor. Part of the issue, especially for kids on the West Side, is they don't know individuals who are doctors. They don't have a family member that's a doc. And my goal is to give them a friendly face to say, hey, this is something you can do. There will be sacrifices. No ifs, ands, or buts about it. But it's worth it if your goal is to be a helpful physician in your community.
Thank you. That was beautiful. And I want to just thank both of you for, giving us your time and helping us to understand the importance of foot health. It is, as you're saying, really a part of a holistic health plan. And so thank you all very much. And we look forward to hopefully having you back on here to talk a little bit more about foot health.
Well, I wanted to say one thing as well, because I work with YouthWorks.
Okay.
So I actually have 3 students in my office. So I also allow students to shadow in my office as well. And they can also go through like YouthWorks, Job Corps, those programs. They can actually request where they want to go to shadow.
Okay.
So like now they're starting their next cohort, which is the fall cohort. And I think now they're adding college kids.
Okay.
So they can shadow you while they're going to college. So those are programs they can work with. I think they also have programs to the Urban League. There's other programs where they can come in and shadow. And I always tell kids, like I had a kid, he wanted to be an oceanographer. And I was like, wow. So I said, why don't you reach out to all the zoos and see if you can do an externship? So his mother said he did get his letter and he started calling. He's still working on it. But a lot of them, I think just the fact that we exist is something for them to see.
Absolutely.
When you walk into a room and you see someone that looks like you, it's phenomenal. It's because fortunately for me, my mother's a nurse. I had a cousin in the family was a physician. Every Halloween I was a physician. So, but it was always something from the day I was born. I wanted to be a doctor.
Excellent.
But I saw it. I experienced healthcare my entire life. So that's what our goal is, to just let them see us. When we walk into the room, you'll see their little eyes get wider. Because they, like you said, there's not many African American physicians, and there's even fewer podiatrists. We are a very small group. I think how many of us is in Dayton? 4?
4 of us.
4 of us.
Okay. Wow.
So it's not many. Small. And I'm the only one that actually owns my own practice. So I'm solo practitioner. So it's a total, we're all doing different things in the spectrum. But, if a kid wants to shadow me or learn what I can do, and like you said, we can help you learn about the MCAT, and because I actually had a student call me from Central State, and I was like, she wanted to go to medical school. I'm like, well, what's your GPA? Have you taken the MCAT? And she hadn't done any of that. And I was like, you're just now calling me?
Right.
So I said I need to reach out to my school, which they did do a program with Central State right before COVID hit. We did, our podiatry school came up here and we did a suturing workshop. And the next time it was scheduled, COVID hit. So actually, I do need to reach back out to our school to come back to Central State and Wilberforce, so to help recruit more African American kids.
Beautiful, beautiful. Well, Dr. Richmond, Dr. Ballinger, thank you both once again for being a part of this program, and hopefully, we'll have you all both on here again. And social media. And you said we can follow you on your podcast, in your social media, and
I don't have social media.
Okay.
But once again, through the Kettering Health Network, if you find that the care that we're giving is good for you, your family, there are letters to our social network that you can put on, and through the Kettering Health, you can get at it that way.
Okay. Thank you. Thank you both very much.
Okay.
Right, thank you.
All right. And we're going to go ahead and end out. If you like this program, please follow and subscribe. And also check your feet tonight. Check your feet tonight. And don't get the Epsom salt out. And so with that, may God bless.
All right.